Good morning or good evening or good afternoon, my friends. So today is our very first episode of our podcast sa ating Jim Jong YouTube channel. And the intention of this video, the intention of actually the channel is to help people. And we all know we have concerns, but we do not have the time, we do not have money. Basically, we do not have resources or we do not know where to go. So again, one of the reasons why I am here is that I want to bring you the people who can help you. So today, the first guest ever is the head of the sleep laboratory of the University of the East Ramon Magsaysay Memorial Medical Center Incorporated, and she is also the insomnia clinic. She's also with the Insomnia Clinic Comprehensive Sleep Disorder Center of St. Luke's Medical Center QC and also Global City. She is a mother, a wife. She's my sister, ladies and gentlemen. I hope I got this right kasi pinilitan niya na pangalan niya. Dr. April Fatima J. Hernandez. Woo! Doc, good
Thank you
evening.
very much for inviting me, and it's an honor to be your first ever guest in your podcast.
Okay, so one of the reasons din na happy ako kung bakit yung sister ko yun sa first podcast natin. Kasi ever since I was little, ang mga ano pa talaga, ang number one fans ko talaga are my sisters, including Ate BJ and yes, Ate Pin. And they are also my number one critic. That's why I love them so much. So now we are older, we're gonna move along with our um, topic today. Basically, the topic is sleep, everything about
Mm.
sleep and stress management. So we're going to make it as concise as possible. Very not scientific yung mga words na gagamitin natin because we want people to understand and we want to
Okay,
help
okay.
people. We are not here to flex, pero we are here to help. So first question, Doc, very simple. Why is sleep important? Boom.
Because sleep is natural, sleep is expected. Every day, you have to experience sleep because we are designed to sleep every day.
Mhm.
It has no one particular physiologic function. So wala siyang isang function. It has multiple functions from energy conservation to immunity boost to memory consolidation, meaning for our memory improvement and for our emotions as well. So sleep is very important because it has multiple functions and it is a natural phenomenon that is experienced every day.
Doc, there was a time, maybe I think it was during the 90s or early 2000, na sinasabi nila na sleep is for the weak or you have all the time to sleep when you are dead. Now, there were people na who really adhered to that notion kasi nga magtatrabaho sila, gusto nila mag-succeed sa life, whatever it may be. Ano na po nangyari sa kanila?
Actually, there are a lot of successful people who would try to reduce the number of their sleep. They practice sleeping less than 5 hours per day because they would like to maximize their waking time. But we know chronic sleep deprivation would increase your risk for heart attack, for stroke, memory impairment, makakalimutin ka if kulang ka sa tulog, mas mainit ulo mo.
Mhm.
If you are feeling sad and down, mas na-emphasize yung feeling of depression. So, studies show that chronic sleep deprivation is not good for us, but also, study shows that very successful people would tend to sleep less than those who are not that successful. So, um, yun, that's
Alright.
the studies.
So
Oo.
I have to sleep less. I have to sleep less. But anyway, yes. So
Mm-mm.
we understand that sleep is very important. I would like to emphasize again that there's a study. We can point a finger, but there's a study that says that There are successful people, and we have to
Mm-mm.
identify what success means. Success may be success in their career. Maybe they have more money. Maybe they have a bigger company. Maybe they have more clients. They have more whatever. All right. So, one of the things that I would like to emphasize is that you, us as a person, that it is a choice between good health or success. So, Doc, ano po masasabi ninyo? Kung kayo po,
Mm.
good health or success? Tipong Elon Musk, mga ganung level. Ano po?
We should have a balance. There's always a balance. No. Sabi nila, make sleep a priority. But if you sleep more than 10 hours a day, it also increases your risk for a lot of medical condition. So,
Mhm.
balance lang talaga siya. You can check your required number of hours ng sleep per age. There are a lot of articles that will show, for example, our age group, it is required that we go to sleep for 7 to 9 hours per day, but not as much, but not more than 10 hours or not less than 5 hours per day. So parang kailangan mo rin ng balance. For example, your work requires you to stay up late. For example, what we're doing right now. And
Yes.
it's okay.
Okay.
Because you can always make bawi. Sleep can be you can recover from a poor night. Um you can recover after 2 to 3 days if you fail to sleep overnight. So okay lang yun. I always tell my patients, yung tulog, siya ay ang utang na sinisingil talaga. So, you don't have to worry because masisingil ka naman talaga yung makakatulog. Mababawi mo naman yun.
Regarding sa tulog, kasi pagkakaintindi ko po, what I understand is that there is called sleep and there is also quality sleep. How
Mm,
would you know that you are getting enough sleep? O,
that's
kasi,
very good.
yeah, di ba?
Oo.
How do you do that? How do you say that?
That's a very good question kasi it doesn't mean that if you get 9 hours, that's a good sleep already. No, a quality sleep is defined as number one, paghiga mo sa kama, within 20 minutes nakatulog ka na.
Okay, 20
Meaning
minutes, guys.
paghiga mo sa kama, turn off the light, nag-decide ka matulog within 20 minutes, nakatulog ka na.
20
Second,
minutes. Okay.
kapag nagising ka ng isang beses or less than one the entire night. And if ever man nagising ka in the middle of the night, you can go back to sleep within 20 to 30 minutes. So that's the definition of a quality sleep.
So, it's okay to wake up, for example, nasipa ka ng katabi mo,
It's okay
or
as long as
nalaglag
you're
ka,
able to go back.
back to sleep.
Oo. Yes, so that's quality sleep. So if sabi mo, Doktora, hindi naman ako nagta-time. I don't know
Mm,
the 20 minutes, I don't know
mm.
that. Then maybe you're getting the quality sleep because you're not that conscious anymore. Nakakabalik ka na agad sa tulog. Or we also ask the patient, how are you feeling during the day?
During the day. Alright, sige.
Okay, so for example, you had 4 hours of sleep. Pero pagising mo, wala namang masakit, walang mabigat, walang antok na pakiramdam. You were able to do all your tasks and everything that you need to do for the entire day. Then that's a good sleep. It's a good enough sleep.
Nabanggit niyo, Doc, na when you wake up, you don't feel tired, you don't feel parang something's aching, parang, I
Ah,
mean,
ah.
nakagalaw ka na mabuti, wala pong kalawang yung mga joints. Uh, okay, that's very good. Pero the next question is, ano po yung condition ng mga tao na they cannot function properly pag hindi sila nagkakape to start the day? Is there any connection between them getting the coffee
Coffee?
first? Yeah, coffee first,
Ah,
is that sleep or habit or ano po ba yun?
coffee is a stimulant. Okay, so it's a stimulant that we abuse. And it's okay. it's okay to drink coffee. So if you're feeling kind of low, you use it as a chemical para magising ka. Ang question mo siguro
Yeah,
bakit kailangan mo siya?
yes. Was that an indicator of poor sleep? Kasi may mga tao, may mga meme, ang dami mga joke and memes sa internet na nagsabi, I cannot start my day kung hindi pa ako nagkakape. It's just that habit
Hmm.
or it's because of a reflection of poor sleep?
It could be a habit. It could also be a reflection of poor sleep, why you need a wake upper. Um, it could be a reflection of your circadian rhythm. Yung body clock mo, hindi pa naman siya gising ng oras na yun, but you're trying to wake up at that certain hour. Marami yung possible factors eh. Pwedeng sanay na yung katawan mo na hinahanap mo siya. Or it could be a behavior.
Mm-hmm.
Yung behavior na hinahanap mo. Kasi tayo as a human, we follow a certain routine.
Yes.
Meron tayong mga cues,
Yes.
kumbaga, na pag ginawa mo ko to, ito yung mangyayari. That's unconscious. So, kunwari, sanay ka na na pag uminom na ako ng breakfast ng coffee, I'm
Good
good
na
to
ako.
go. Oh, so behavioral siya na ano na kaya mo siya ginagawa every day.
Yan po ba yung tinatawag nila, Doc, na cue reward? Cue habit and then reward? Na
Siguro.
gising na,
Ah,
inom na, and then
ah.
after the reward. Well, anyway, so nabanggit niyo po yung circadian rhythm. Can we explain more of that para mas naiintindihan po natin yung ating parang yung ating body? Why is it like this? And hindi kasi sila
Okay.
makakuha ng ng appointment with you, Doc, kasi puno na. By the way, listeners, puno na po kasi yung yung appointment ni Doktora. So, hindi na po tayo makakasingit. Kaya po tayo na dito kasi tatanungin natin lahat. Go, Doc. Circadian rhythm.
Circadian rhythm or yung sige, body clock na tinatawag natin is controlled by the brain. So may part ng brain natin na nagko-control nung oras natin sa katawan. So in connection to sleep, kasi hindi lang naman sleep yung kinokontrol ni biological clock. Ang dami niyang hormones na kinokontrol. So sa sleep lang tayo mag-focus. So, regarding sleep,
Sleep lang.
alam na ng body mo kung ano yung waking time mo.
Mm-hmm.
So for example, ako personally, I would wake up at 6 a.m. every day, regardless of what time I would go to bed. So kahit na 4 a.m. na ako natulog, magigising talaga ako ng 6 because that's my body clock. Meaning, around that time, my arousal system or yung panggising ko sa katawan ay slowly umaangat na yon. Okay? So, dahan-dahan siyang umaangat. Gigisingin ka talaga niya kahit wala kang tulog. But you would feel sleepy, tired,
Mm.
lousy, kasi kulang nga yung tulog mo. Pero kahit anong pilit mong matulog dyan,
Hindi
hindi ka talaga makakatulog kasi aangat na yung arousal system mo and then slowly in the afternoon, bababa na siya. Prepare you for sleep. And I'm sure you know how early I go to bed.
Yes.
Diba?
Yeah.
So, because my body clock or my arousal system is very low na around 9 p.m., 9 to 10. Kaya sleepy na ako around that time. Ikaw, alam ko, yung body clock mo, your arousal system rises a little bit later in the morning. So you can
Successful
expect
there. Successful people. Here you go. Yeah.
So your arousal system rises a little later. That's why you would wake up late. So sabihin na natin nagigising ka ng mga 10. Ganon. Yun yung parang okay. I'm good
Yeah.
to go. 10
Yeah.
a.m. So kunwari you have to wake up earlier, then you are trying to wake up wherein your arousal system is still low. That's why you feel, I need coffee. Kasi pinipilit mo yung katawan mong magising at a certain time. So yung may body clock na tayo, it's internal. This is controlled by cues. Ano yung cues natin? Sunlight.
Okay.
Okay, so kapag nagising ako sa umaga, naarawan na yung mata ko, alam na mag-shut off na yung melatonin ko sa brain, mag-turn on na ang arousal chemicals ko sa brain. So, umaga na. So, ibig sabihin yung sa'yo, if pwede mo namang i-move, kunyari, everyday ka, magigising ka ng earlier, Pero siguraduhin mo lang na maaarawan ka para mag-turn off na yung melatonin at turn on na yung arousal chemicals mo. Parang ganun. So,
Or okay, since we are talking about, time of sleep, what are the case with people with insomnia? Can we talk about insomnia? What's insomnia?
insomnia is a complaint from a patient. No? Nagko-complain siya na hirap pa ako makasimula ng tulog, difficulty initiating sleep. Hirap pa ako mag-maintain ng tulog ko. Okay? And or I wake up too early. I wake up 2 hours before my usual rise time. So sabihin natin nagigising ka talaga ng 6 a.m.
Mm-hmm.
pero you found yourself waking up 4 a.m. every day and you
Mm-hmm.
cannot go back to
About to
sleep. So
sleep.
that's insomnia. So there has to be a complaint from the patient na meron siyang difficulties in those at least one of those three aspects.
So these people with complaints, bakit sila, why do they have this thing na tayo dalawa, nakapikit lang, nakapaghiga, tulog na agad. And there are people who are blessed like that. These people with insomnia, what's up? What's up with them?
40% of patients with insomnia are due to psychiatric conditions. The rest are due to other medical conditions or other sleep disorders. So 40% lang naman yung mga pasyenteng nagwo-worry, nalulungkot, hindi mapakali, kaya hindi sila makatulog. Pero yung iba, they could be suffering from pain, baka may masakit. They could be suffering from allergies, baka hindi sila makahinga. They could also be suffering from GERD. So kapag humiga sila, nagkakaroon sila ng regurgitation, chest discomfort. Baka pwede silang may mga ibang sleep disorders such as sleep apnea, yung snoring, or di kaya restless leg syndrome, mga ganon. So, madaming pwedeng causes ng
So
insomnia.
we really can't put our finger as to what causes it, right?
Yeah,
So
depende sa patient.
so shameless plug. If you guys are, concerned na may insomnia kayo, you just go to the doctor. Just go to the doctor and have yourself checked. Kasi for all you know, it's just an easy, parang it's an easy fix. There are times na hindi talaga tayo matutulungan ng Google. Actually, sometimes mas na-worsen pa nila. Kasi, anyway, next question about not getting enough sleep. And I heard that somewhere, or it was mentioned in a lot of researches, that poor sleep can lead to obesity. How does that work? How does connection sa tulog ko and obese ako? That's, yeah.
Okay, so yung sleep, 'di ba, it has multiple functions. So, pati yung regulation or pag-control ng blood sugar mo would depend on your sleep. So, if poor sleep ka or poor quality sleep, meaning shallow yung tulog mo, interrupted, putol-putol, kulang ang tulog, then your blood sugar could not be controlled. It could stay high, no? Tataas siya.
Mm-hmm.
Other than that, your appetite is also controlled by sleep. If you might notice, for example, yung mga call center agents or yung mga nagpupuyat, security guard, doctor, nurses, kapag gabi na or madaling araw na at late na gising pa rin because of duty, you would tend to crave for carbs, high carbohydrate foods.
Bakit
So yung
carbs
matataas
specifically?
na sugar content, yun yung kine-crave ng body mo because you need energy. Okay, you need energy to sustain you the entire night. So, yun ang nangyayari. Mapapakain ka talaga ng mga bad food. So, lalaki ka. No? Nag-gain ng weight. Aside from that, some would like to sustain their alertness at night. So, iinom sila ng coffee. Siyempre, yung coffee may sugar, may cream, yung mga ganun. So, this would contribute to gaining the weight. But for those who are getting sleep naman at night, but the quality is poor. So, for example, may sleep apnea. Putol-putol yung tulog sa gabi. Pagising sa umaga, feeling nila hindi sila nakatulog at all. So, we call that non-restorative sleep. Yung sobrang babaw ng tulog, feeling mo hindi ka natulog.
Yeah.
ganun din ang mangyayari sa'yo. You would also crave for that high
Carbs.
carbohydrate, oo, na food. Kasi nga puyat ka, feeling mo hindi ka nakatulog. Yun yung nangyayari. Kaya nag-gain siya ng weight.
So, as a fitness coach, hindi pala basta-basta lang namin pwedeng sabihin na disiplinahin mo ang bibig mo. Or, you have to
Ay,
tame your mouth. You have to be in control of yourself to stay away from those cakes, cookies, ice cream. It's not that, basically there's also a factor na your body would naturally go for that high carbohydrate food, not because you have no self-discipline. It's just so happen that wala ka ng control.
your body is looking for it. But you also siguro, syempre, if you also have um, clients who are on the heavier side, pwede kasing they also have sleep apnea, no?
Yeah.
Yung sleep disorder na very prevalent among obese individuals. So, pwede mo rin silang i-check or ask them if they're snoring. And kung ma-target mo yon, if you're able to target that, like ask them to go to the sleep doctor and then makokontrol because they're already using CPAP, then it's gonna be easier for them to lose the weight because they're already getting the quality sleep. So kahit na you're training them pero may yung sleep apnea nila tuloy-tuloy lang, then it will be very difficult to control the intake.
So sleep apnea will lead to, for example, for food binging. Question, for example, it just so happened that they're so powerful, they're able to control themselves from eating all of this type of food, pero they still have sleep apnea. Would they still have difficulty losing those pounds?
Um, Yes, because you lack the ability to metabolize your sugar levels, yung mga gano'n. So, mahirapan ka talaga. So, in the treatment of sleep apnea kasi, it's an ano, parang it will augment. So, pang-add siya to
Yeah.
whatever it is you are doing. Not only in fitness, but also in other, because it's also prone to cardiac patients, no, with stroke,
Yeah.
heart attack, stroke. So, dadagdagan niya yun, no, by providing you a quality sleep.
Okay. So, to everybody who's listening, so una-una, if you have a poor sleep, you have a tendency to eat a lot of carbohydrates, a lot of junk food. So, kahit anong training mo, if you have poor sleep, hindi mo, walang kawala. Mahihirapan kasi, you're still binging. Now, okay, let's say you are so strong, you are mentally strong, you are doing the training, you're doing the diet, really doing it. Pero still poor ang sleep, Doc, tama ba that they'll still have difficulty, losing those pounds kahit gaano lang kadisiplina sa diet and sa lifting weights or training? Is that true?
Yeah,
Oh,
but exercise can also create strong muscles, diba? It
yes.
creates strong muscles, and that would also include the muscles that would open up your airway at night. So, kasi pag natutulog tayo sa gabi, our muscles you would tend to relax. And at some point, paralysis nga kapag nasa REM sleep na tayo. So, yung daanan ng airway natin kasi binubuksan niya ng muscle na gano'n para mag-open siya. So, kapag natutulog tayo, medyo relax siya. So, medyo lumiliit na yung butas na yun. So, kapag nag-exercise ka daw, nagiging strong yung muscles na yun, and eventually, hindi masyadong nag-close. Regardless of the exercise that you're doing, no, there are also exercises for the oral cavity. Pero sabi nila, kaya kami, when we treat patients na may sleep apnea, we also say you have to exercise. You have to make your muscles strong. Kasi kapag, di ba, women, when after menopause, the muscles become relaxed.
Okay.
Hindi na siya ganun ka-stiff. So, kaya din nagkakaroon ng more events ng snoring kapag beyond menopausal because the muscles are not strong enough. Pero kung nag-exercise ka, magiging somehow tense siya.
Nabanggit ko po, Doc, that, after menopause, women, they lose the stiffness of their muscle. Would that also lead to a higher chance of maybe obesity, maybe? No?
Actually, it for sleep, it increases your chance for sleep apnea and insomnia.
Okay, okay, okay.
Oh.
Again, you mentioned earlier about the weight and sleep apnea or maybe insomnia. What is the percentage of your clients who have sleep apnea or insomnia or basically sleeping disorder? How many percent ang let's say inactive or let's say sedentary?
I don't keep track, but since the bulk of my patients are psychiatric patients with insomnia, siguro more than 50% are not physically active,
Yeah.
that you have to really remind them that, you know, please start from walking, ganyan. And
Okay.
it becomes more difficult because of the pandemic.
Yeah. Um, Now you have also mentioned that you have psychiatric patients. Now I would like for us to move on to let's say stress or stress management. Or basically, the first question is, um, how stressed are Filipinos ngayong 2021? Or na,
2020.
yeah, or 2020 or 20 after the pandemic, how stressed are we? Do we have a study about, our mental, kumbaga parang our mental situation with all of these things happening to us?
Yeah, I don't have the numbers, but what I can tell you is that there is an increase in the utilization of the National Center for Mental Health hotline. So hindi ako sure if you're familiar, but there is a hotline that you can call whenever you are in a psychological distress, or if you're feeling that you need help, or if you are suicidal. So they showed that during the earlier part of 2020, they were getting around 400 calls per day. Yeah, calls. But I'm not sure if it's per day. No, no, no. It's at 400 calls for the month, no?
Okay,
Earlier January for 400 calls lang. But during the start of the pandemic, it
around March.
increased to 1,400 a month. So they have this graph. It's available online that you can check. So tumaas talaga siya yung utilization nung hotline na yon. So is that something that we can interpret, that there is an increase in stress among individuals, or mas na-release lang talaga and na-advertise yung hotline kaya marami nang gumagamit? I don't know. But yes, of course, based on the practice, there's really an increase of anxiety, depression, PTSD during the pandemic.
So we are talking about this is 2020. So
2020.
is there still a graph until like last month?
Not sure. I'm not familiar if there is any. Pero yung nakita ko was including the earlier part of 2021. Which
Okay.
is, hindi na siya 1,600, but it's still on the 1,000 range.
Basically, madami pa din. Kumbaga parang it's not
Oo,
as it's
parang
not.
times two from the previous pre-pandemic.
Oh my God, this is not nakakatakot. And we are, if you're listening and you're not the type of person na tatawag or um let's say you don't feel naman that you are in a psychological disorder, you should consider yourself blessed because a lot of people cannot continue with their lives kasi they're in a psychological disorder. Nabanggit ba, when it comes to stress, is there any way that, we can mitigate stress? I know stress comes from a lot of place, work, personal life, career, or hobbies, or whatever. Kumbaga parang, is there a generic template how we can reduce stress?
Generic template.
Template na kumbaga parang,
Oh.
okay, if you see the stress, this is what you do is calming.
Mm.
Bibilang ka 10 to 10. Or what is it?
Ah,
or
okay.
minimize stress.
We have our own coping mechanisms. Kanya-kanya tayo. No? That's individualized. If, for example, if I feel bad, I would just look at my children, and I'm okay. I would play with my kids, and I'm okay. So what I'm trying to say is you look deeper. You try to remember what were the things that you used to do pre-pandemic, because we will always say, kasi pandemic, kasi pandemic. Look pre-pandemic, look within you kung ano ba yung mga ginagawa ko pag nasa-stress ako. Sabihin nila, "Doktora, magkakape ako sa Starbucks." O di kaya magmo-mall ako. Maglalakad lang ako sa mall tapos magwi-window shopping. Okay.
Shop.
So, yun yung ginagawa mo
Uh,
to feel better. And then they'll tell you, "Doctora, what can I do now?" Diba? I cannot do that.
mhm.
I cannot go to the mall. I cannot even open my cup in the coffee shop because of the fear of getting COVID. Then you modify. If you love coffee, why not start brewing your own
Mm,
at home?
mm,
Okay? If you like window shopping, okay, get your cell phone. And you know the popular apps, di ba? So,
yes.
I mean, we have our own. So, if I tell you, breathe, hinga ka. And if you're the type of person who is super conscious, who is not into meditation, if you're
Mm,
not into relaxation, then the breathing techniques will not work.
okay.
Okay. So, yun lang yun. Yun lang yung pwede mong gawin. Kung gusto mo kasi generic, di ba? What will work
Parang
for everyone?
take
Oo.
template. Next question kasi, I've been in fitness and I've studied about, the hormones that makes us happy, like what I mentioned to you like 6, 7, 8 months ago. Um, I know that endorphin and dopamine, they are addictive, although they feel good, and yet they are addictive. But serotonin and oxytocin, all of those things make you feel good. They are not addictive. Is there a certain chemical that, for example, when I do go window shopping, and what's the chemical that that nasisecrete ko from those things that makes me feel good? Window shopping or
Yeah.
coffee.
So, yung mga dopamine na sinasabi mo, those are the reward system.
Mm,
Oh, so you feel good because the reward system is activated, and the production of dopamine then stimulates your other parts of the brain. That's why you became focused. Then it become a very good memory for you, yung ginawa mo. So, yung sinasabi mong mga serotonin, those are the chemicals naman that would help you focus, that would help you calm your nerves.
okay,
So, for
okay.
example,
Yes, how to do that? Yeah.
nag-a-anxious ka na, or na marami kang thoughts, marami kang
Mm,
worries in your head. So, they said serotonin would calm you down, would
okay.
slow down the thoughts, and that would the serotonin would relax you and somehow um, help you decide. So, more cognitive yung kanyang effect. No, cognitive meaning decision making, diskarte,
What are
memory,
the things that we can do para ma-secrete natin yung serotonin na yun,
paaraw ka.
paaraw? Is that one of the reasons that they say na kumbaga parang it's nice to walk? So, or yung ayaw na may mga tao na ayaw nila yung maulap, yung gloomy, ayaw nila ng gloomy, gusto nila maaraw.
Yes.
Oh.
'Di ba merong seasonal affective disorder? It is
Yeah.
depression during winter time. Siyempre wala naman tayong winter. But you would also experience that pag tag-ulan. I don't know if
Mm.
you can remember, there was a time, ang tagal-tagal naman ng tag-ulan. I think last year yun. That people cannot even if you open your windows, wala ka namang sunlight. There's no sunlight. And then a lot of people are feeling bad. A lot of my patients would complain, wala kasing araw, doktora. And it's true. If there's sun kasi, the sun hits the eye and suddenly your
Boom.
serotonin are
Boom.
produced. So, ideally, you get that morning sun every day. 20 minutes.
Anong oras yan, Doc? Of
6
course,
to
hindi yan 12
9.
o'clock. 6 to 9. I have
Oo.
a friend, meron siyang in-laws na nagtatrabaho sa
Hmm.
Ireland, if I'm not mistaken. I think it's Ireland.
Hmm.
And it's always gloomy, bihira lang yung araw doon. And one of the,
Yes.
kumbaga parang, uh,
Yes.
one of the facilities where ang daming Filipino is the mental institution. I mean, may relation po ba yan? Yung parang gloomy the
Yes.
entire year. So, I'm sad.
Oo. That's why we have the UV light. We have the UV light therapy. You expose yourself to 10,000 lux of UV light.
10,000 lux,
Uh,
okay?
every morning for 15 minutes. Others would do it by pulses. Parang 1 minute tas off, tapos 1 minute tas off. Iba
What
naman, tuloy-tuloy, 15 minutes.
what are the other ways that we can secrete serotonin? Sorry, serotonin.
Exercises, when you're doing what you love, when you're using your brain, when you're doing cognitive exercises, for example, planning, gumagawa ka ng
Oh,
recipe, you're doing your journals.
yan ba yung pag
Yan.
nagpaplano kayo, kumbaga parang creative juices na parang, oh, sige, sige, ito gagawin natin. Oh, tapos ganyan, tapos ganito.
Yun, kahit hindi naman creative, as long as you're using your brain. It's not a passive activity.
It's not a
Like
passive, yeah. Sige.
for example, listening to us right now is actually a passive activity.
Mhm.
If you want to make this an active activity, you write down, you take down notes, you reflect. Ano
And,
yung nasabi
and that
kanina?
secretes serotonin.
And that stimulates
It stimulates, yeah.
other
Okay.
than madami pang
How about EDSO? Oxytocin daw. How are we going how can we hack our body to secrete those things or to
the same
stimulate
lang
it?
naman sila. They all belong to the same area in the brain. No,
Okay.
yeah, it's amazing because there are a lot of things that we do not know.
Oh yeah,
but
medicine nga
but
pala guys, it's not an exact
especially in the
science. It's
brain.
not an exact science. We're still learning. Yeah, yeah, yes.
Oo, no. Yeah, so you do what you like. Kunyari, exercise does a lot to us, to our brain. 20 minutes lang nga, sabi ni WHO eh. 20 minutes, 3 times a week. Kahit ganun lang kakonti.
So
It
guys,
already improves our mental
workout
health.
lang pala. Okay, you know who to
Oo.
call. You know who to call.
Mm.
I heard that hugging, hugging, touching other people.
Mm.
When babies hug their mom, parang
Mm.
it secretes oxytocin and kumbaga parang it's the trust hormone that the mother and the child get from one another. Kaya kumbaga parang pag nagpapa-breastfeed yung mga ladies, parang, they feel good, they feel accomplished. Pero hindi lang oxytocin yun, Doc. Marami pang ibang surging hormones, parang feel-good hormones for that to happen. Tama po.
Ang dami ding theories na
Theory. Okay,
if
okay.
you go into psychology, there are theories that would explain why it is important, why hugging is important, why eye-to-eye contact is important, why you should be relaxed when you are hugging your baby. No, so yung mga attachment theories, secure or unsecure attachment, anxious attachment, may maraming pwedeng mag-explain nun. But basically, hindi lang yung warmth, hindi lang yung hug ang important, hindi lang yon, but also the mental state of the hugger to the child. So,
Yeah, yung energy.
kung
Kumbaga parang
kung anxious yung
yeah.
humahawak,
Mm.
paano ba to? Paano ba to? So the baby would also feel, ano ba yan? Alam niya ba yung ginagawa niya?
So,
No?
nasa-stress din si baby.
Stress din siya.
Is
Hindi din
that
siya
is that the reason why there are people who really claim, I'm really good with babies. Kahit hindi ko anak, you give it to me, I'll carry them, and I can put them to sleep na hindi naman niya kaano-ano. Because,
mag-
it's the energy. Kumbaga pa, if you're a
It's the
hippie, it's the energy.
energy. Oo.
And then natatransfer yun sa bata.
Nasa-sense niya yun eh. Kasi we use our senses, diba?
Yeah.
There are, di ba, may therapy na mindfulness therapy which uses all your senses. Ganun siya ka-important. So, yung baby, mafe-feel niya talaga yon through touch. If you're sad, if you're depressed, your baby will cry? Bakit cranky yung bata? Bakit hindi siya tatahimik? Na-feed ko naman and all. Baka may postpartum si mommy. So
Oh,
nafe-feel yun nung baby. Kaya, we have to also be mindful of that. Hindi lang important na kasi tinouch mo siya, okay na yun. Hindi.
so when we're talking about things like this, that makes us feel good, things that makes us feel bad, what we can deduce right now that everything is interlinked to one another, from your sleep, from the food that you eat, from your exercise, to the energy of your spouse, to the energy of your kids. uh, Everything is interlinked together. And I do understand that all of us, we are experiencing certain stress. We have all our stresses in our lives. um, some of us cope through using, let's say, substances that are not good for us. Some of us are coping by, like what you mentioned earlier. I'm stressed. Okay, I'm gonna work out. I am stressed. I'm gonna do what I love. I'm going to write. I am going to take care of my children. But I would like us to talk about those people who are using means that are not, very healthy for them. What is your advice to these people to, kumbaga, parang to minimize or to stay away from? Yes, I know we need to soothe ourselves. Everybody needs to soothe, you know themselves. Pero ano po yung masasabi niyo sa mga tao? Instead of doing
Okay.
that, do this. Yeah.
Parang tawag namin doon is maladaptive behaviors, no? They're trying to cope on their own. Siguro yung sa medication, self-medication, they would try to self-medicate. But the behavior is not acceptable. No?
Mm.
Hindi siya
Correct.
katulad ng exercise na acceptable. So, yung sa kanila, maladaptive siya kasi hindi siya acceptable. So, you just try to look into the underlying conditions. Bakit kailangan niya mag-self-medicate?
Mm-hmm.
Bakit kailangan niya ng ganito para makalma lang siya? Bakit kailangan niya ng ganito para ma-happy lang siya? So, you have to
Mm.
target if there's an underlying depression or anxiety or ADHD, yun yung madalas sa substance abuse. Let's go to as simple as binge eating.
Yeah.
Okay? So, there are people who are feeling stressed and they would suddenly, kakain ako today. No? Kakain ako ng maraming marami. And then they would feel guilty afterwards. So meaning they're oral. So
Mm.
ang oral gratification sila. So these are also the individuals who would smoke, who would
Okay.
drink, ganyan. So why not turn it to something adaptive? Yung food cravings na yon. Okay, so kunyari gusto mo kumain, why not choose the healthier options? Gusto ko binge eh. Why don't you
Mm.
just choose the healthier options kung ganun yung adaptive behaviors mo? Why don't you prepare the food instead?
Kasi,
If food makes you happy. So parang you can just convert it to something
yeah, yeah.
acceptable.
What if, Doc, for example, your client would say, kasi doktora, mas masarap po kasi yung cake kaysa sa salad. Anong, oh,
Balance, 'di ba?
yeah.
There should be a balance. May balance ka. Mahirap if you deprive yourself. So for example, okay, I will not eat cake talaga at all for 1 month. Tapos next month naman, sobra naman. Kasi hindi ako nagkain last month.
Last
Hindi
month.
ako kumain last month. So, kailangan mo lang siya ng balance. Um, Pwede mo naman siyang i-convert into something na acceptable. So, for example, mag-bake ka or mag try to sell it. Magbenta ka na lang para kumita ka. Pero food pa rin yun.
Ito na ba yung time na, kasi earlier we mentioned na there are things talaga na that we really can control. Pero ito na ba yung time na pwede na natin gagamitin yung discipline card? Ito na ba yun?
Yeah.
Dito na labas yung discipline card na, okay, this time you really have to discipline na talaga yourself. Hindi, kasi madali lang kasi i-blame yung, kasi hindi kasi ako nakatulog so magka-carbs na naman ako on the 365th day of the
Uh,
year. So, it's a
no.
balance between your discipline and, good sleep or good stress management. Ganun po ba yun?
At the end of the day, you need to know the goal. What is the motivation behind it? Because if there's no motivation, walang something that would push that person to do it. Like for
Mm-hmm.
example, sa
Yeah,
sleep,
yeah.
kung gusto mo magising na maaga dahil ayaw mong malate sa work, then that's a motivation. Then you can correct that circadian rhythm or body clock that you want to correct. But if there's no goal to wake up early, so okay lang, business naman to. Okay lang
Mm.
na I can go to work at 1 p.m.
Mm.
So hindi mo siya hindi mo siya magagawa. Kailangan kasi like for example in controlling substance abuse, motivational therapy is utilized.
How do you do that?
Kailangan remind mo lang talaga ano ba itong motivation mo? Why are you doing this? Para saan ba ito? So kapag reminded sila nun, somehow it keeps or it helps them maintain the behavior, the good behavior na gusto mong i-reinforce.
Can I, for example, that I'm really stressed and for example, work, or let's say, very common, COVID now, negosyo ko bumagsak.
Mm.
Dok, wala na po talaga akong magawa. Hindi ko na alam anong gagawin ko. Wala na akong magawa. Hindi ko alam anong gagawin ko. I feel so stressed. I do not know what to do. I do not know what to tell the bank. I do not know what to tell the family. I mean, I'm so stressed. I cannot sleep. What is the best thing for me to do? I think a lot of, if ever you're watching, I think maraming makaka-relate po. So, ano pong, ano pong masasabi nito?
Whatever happens during the day, it could definitely affect your night. So if you know that you got a bad phone call during the day and you know that you'll be thinking about it the entire day, sure na yon. Paghiga mo sa kama, nasa isip mo pa rin yon. And that would prevent you from sleeping.
Mm-hmm.
So, practical solutions, no? To avoid occurrence of anxiety, you have to have practical solutions. Hindi ito dapat rocket science solution.
Sige, sige. Ano
Hindi
bang
siya
solution?
dapat practical. It should come from you, no? So for example, yun nga yung example mo is nawalan ka ng work,
Mm.
'di ba? Nawalan ka ng work. Why don't you utilize? Ano ba yung pwede kong gawin now?
Mm.
Because
Okay.
if you just sulk and sit in the chair and think and worry, then yun yung anxiety, depression. But if you are looking for a solution to that situation, then mas makakatulog ka sa gabi.
I would like to reiterate what Doc told me a couple of years ago. Very simple. In order for you to battle anxiety, you just have to be prepared.
Anticipation.
Doc, can
Mm-mm.
you can you can you expand on that because you're the right person to tell me? Because you mentioned back
Anticip-
then, you're anxious, you have an exam, then study. Can you explain that
yeah.
further? Para mas
Yun yung
maintindihan ko.
practical.
Yeah, 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 yeah. So that they would
Yun yung
understand.
practical.
No?
Oo, yun yun. Anticipation of the future. But it could also be something na mag-feed ng anxiety mo. For example, anticipate ka na magka-COVID ako. Baka magka-COVID ako.
Yeah, I
So,
know.
mangyayari, you become vigilant. Mag-PPE ako, mag-alcohol ako, because you want to be
Protected.
prepared, no? But there are people who would super overly anticipate naman.
Extreme
So,
naman yun. Yeah.
parang hindi rin siya
Healthy.
balance. Siguro yun, practical solutions yun yung exams. O sige,
Aral ako.
this popular politician, 'di ba? She posted that she was crying to her father because she's having a hard time with law school.
Mm-hmm.
And then the father just said, "Why are you crying? You should be studying right now." Ay, 'di ba? So
Not rocket science.
hindi siya rocket science, but sometimes our emotions get into us. So parang ganon. You can have your moment. Pwede kang umiyak, pwede
Yeah,
kang malungkot.
yeah.
But you can just, okay, hindi sana yung 1 hour kong pag-complain, inaral ko, at least
Nagtrabaho na.
naka 2 pages. Baka nakapag 2 pages pa ako.
One of my coaches, he mentioned to us, no, kasi in the fitness industry, nahihirapan kaming maghanap ng clients. kasi, the gyms are closed all the time, especially sa NCR. And yeah, there will be a lot of times that my friends, especially in your area in NCR, na, diba, parang they're complaining, they're complaining about this. And a coach of mine, he just said that, alam nyo, ang problema kasi sa atin, puro tayo reklamo. Why don't, instead of complaining, do what we can right now, like Zoom, and then move on with our lives rather than stressing it out right now na wala. 2 months, 3 months na tayo nagre-reklamo. Sino hindi natalo? Tayo lang din. So I think that's what you're saying about, it's not rocket science is merong, kumbaga parang there is a practical solution. Now, one of, couple of last questions na lang, Doc, no? If you are, let's say you are stressed or you are depressed, how are you going to say it to your family? For example, your spouse. How would
Actually,
you
you don't
say it?
need to say it. If you're depressed, people would know and people would see it. If the people around you are very observant and they know you, makikita nila yun because depression causes changes in your behavior. So, merong off sa'yo. May iba. Um, that's why it's easier to tell other people than telling your relatives kasi you feel hindi ka ma-judge.
Yeah,
No?
yeah, yeah,
So,
yeah, yeah.
you can, if para sa'yo ganun ay mas madali, it's all right. Then you can look for that person that you feel safe. No? So, kami mga psychiatrists, counselors, psychologists, we provide a safe place to our clients. Um, so you cannot force someone to tell, uy, ba't di mo sinabi sa family mo? Because they don't feel safe when they say that. That's why it's easier to talk to people that they don't know.
It,
Kasi alam nila na hindi sila ma-judge. So, we don't expect na people would tell relatives at all. But your question is, how would you tell?
how would you tell?
If you have a very good support system, if the people around you are very
Support
observant
system.
and they know you, they would observe changes in your behavior.
What if poor support system? Find that one person na nakikinig sa'yo. It's like,
Look for a psychiatrist or a psychologist to help you because your friends cannot therapy you.
no, no, you tell
Diba?
them. Kasi di ba parang you have to open up. It's
Ah,
like going out of the closet. So if you cannot tell
yes,
your family, if you feel that you're unsafe, you talk to someone that you feel safe with.
yes.
Like
A
a fitness coach.
friend, either a fitness, a teacher, a mentor. Yes.
Or a doctor. Especially go to the doctor. What can you say? I think na-answer na ito kanina, pero the simplest way, ano pang advice natin sa mga taong going through difficult times right now? And, that feeling na uneasy ka, hindi ka nakakatulog, nangangayayat ka. Kahit hindi ka nakakatulog, mabuti na nangangayayat ka pa rin.
Mm.
What is your advice?
Ask for help. Look for help. It's available. Especially now it's teleconsult. You cannot say, the doctors or psychiatrists are only in Metro Manila. No. We see patients even in outside Metro Manila. So telepsychiatry has been there even before the pandemic.
Hmm.
Nauna na talaga yung telepsychiatry, but now it is utilized more because of the pandemic. So, you ask for help. Sabi nga nila, you don't be afraid, no? Kasi hindi naman lahat ng pupunta sa amin may diagnosis agad.
Yeah. That's
So
very
parang, ay,
professional to say, no? Yeah.
kailangan mo lang pala ng psychoeducation, meaning you just have to understand your behavior lang pala. So, ask for help.
Maybe I don't know if it's a Filipino trait or ano ba.
Ay,
Kasi I think there's a stigma na pag pupunta ka sa psychiatrist, you're crazy. So
yes, yes.
yeah.
Studies show na um, the number one, these are the factors or barriers bakit hindi nagpapa-check up ang Pilipino. Kahit saan man siya sa parte ng mundo. Number one,
Hindi
syempre,
lang para sa
financial.
Philippines yun.
Hindi lang sa Philippines, basta Filipino ka, no? Syempre, financial constraints.
Mhm.
Um, nakakahiya, loss of
Yes,
taste, oo.
yes,
And
yes,
then I have to comply with the culture
yes.
that Filipinos would go to families first as their therapist before they go to a doctor. And kasi nga we are branded as self-reliant
Mm,
and
mm.
so hindi tayo and resilient. So it's not natural for us to seek help. Pupunta na tayo sa doktor when it's
Malala
severe
na. Mm.
already. So, yun talaga yung trait. It's a behavior. Other than the stigma itself, yung meron because of being Filipino.
How much of your clients are men and women? Ano po yung ratio?
Oh, pero 50-50. Yeah, if
50-50.
I look at my graph, parang ganon. Medyo marami lang female. Siguro because I'm female, no? But my graph shows naman parang equal.
I read this, alam mo na, ang dami natin nababasa sa Facebook or sa Instagram, and everybody has their own opinion. And I read this that it's hard for men to talk about their emotions kasi yun na nga, we were brought up as kids na ang lalaki hindi dapat umiyak, ano man yan, matapang
Mm.
tayo. So,
Mm.
one of the things din na gusto kong sabihin din sa mga men na it's okay to cry, it's okay to see the doctor, it's okay well, of course balance naman, hindi pwede yung konting ano lang pupunta ka na tayo sa doctor, it's still a balance. Kaya natanong ko do kasi um pero nabanggit niyo na rin na it's 50-50. Nakakahiya ko kasi talaga pupunta ng psychiatrist. Kasi baka isipin nila na sira, may sira.
Oo.
So, do you have
Yun
that? Do you
talaga.
have those clients na parang, alam mo, Dok, nahiya talaga akong lumapit sa inyo kasi baka isipin nyo sira
Yeah.
ulo ako.
Oo. It causes delay
Cautious
in
delay.
seeking treatment. Oo. Kaya mas mahirap na. Mas mahirap na. But what's good about it is once they're educated,
Mm-hmm.
it's easier for them to seek consult and also their family members. Kasi there's this one person who is already there eh.
Yeah.
Parang kumbaga naintindihan na niya and then he knows na oh sige, so if I have a sibling
Mm-hmm.
or a friend, ganun, ang dali niya. I think I also, because I'm a sleep specialist, they don't see me as a psychiatrist
Mm-hmm.
agad-agad. That's why I also get that average. Kaya I also get patients because it nakalagay kasi sleep specialist.
Yeah.
Tapos yung psychiatrist sa ilalim. So parang for them it
Oo.
it parang oh sige I went to a sleep doctor. Parang gano'n
Yeah.
lang siya. Oo.
Nahirapan ako
Pero
nahirapan ako matulog. Pumunta ako ng sleep doctor, pre. So, rather
which
than,
which
yeah.
actually parang maganda. I'm giving them a service na parang oh ayan nakukuha ko rin yung psych talaga na problem.
Okay, thank you very much. I think we've been here for more than an hour or almost an hour.
Mm.
Um, thank you very much, Doc. You know what? What I have learned today, I hope a lot of people also learn them.
Mm.
And to sum everything up, go see a doctor. Go see a doctor. I think, are there other sleep doctors like you? Or are there other sleep doctors like you in the
Na
Philippines?
psychiatrist,
Na psychiatrist din?
there are two of us.
Dalawa na kayo yun.
Uh, yes. She Dr. Rock is from Makati Medical Center
Okay.
and Lung Center.
Mhm.
So, yun, dalawa kami in the
Psych
country.
na sleep
Sleep
doctor.
specialist and psychiatrist. Yes.
Okay. So,
There are some who would claim, but in the society there's just two of us.
okay. So, pero kasi baka people will be thinking, dalawa lang sila, baka hindi kasya yung mga pasyente. Baka hindi na tayo makasingil. Guys, I would also like you to understand that any regular psychiatrist pwede namang puntahan. And tandaan po ninyo na there is what you call the, ano pa na? Pwede, pag
Tele-
online lang, pag ina-assess,
Teleconsultation.
teleconsultation. So, wala yung feeling na pupunta ako doon. Tapos,
Yes.
bubuksan ko yung clinic, magpapa-schedule po ako ng
Walang waiting
Walang
line
ganon.
sa
Walang waiting line, tapos
labas.
titingin kayo kung
Oo.
okay, so ito pala lahat
Ah,
yung mga, right?
walang
So,
gano'n, oo.
guys, my sister, if you can find her in Facebook, you can find her in Facebook. Her name is, wait,
April
April.
Hernandez, but just Google, makikita mo na siya agad, April Fatima Hernandez. You will be directed to a link for my teleconsultation.
Yun, so mabilis na lang pala. I-google nyo lang.
Oo,
April
Google mo na
Fatima
siya.
Hernandez. Okay, just for everybody to know, bakit ako nag-stutter nung sinabi ko ang pangalan niya ay, because for the longest time, my sister, we've been calling her Pim.
PM, yeah.
Pim. So, hindi siya si Dr. April, siya si Dr. Pim. Parang si Ant-Man. Anyway,
Yeah,
yeah,
that's right.
yeah. So, April Fatima Hernandez, just Google her and try to contact her because everybody needs help, because everybody deserves to live better, my friends. And I think that's all the time that we have right now. It's late. Late na, nire-record pa rin namin to late, but our goal is we want to help you. Doc, any last words?
Um, Make sleep as a priority. Okay. But it doesn't matter how long. Do not count the numbers. It's how you feel during the day. So if you feel great, if you feel wonderful, then you had a very good sleep. Um, if you're feeling sad, if you're feeling anxious, do not forget to breathe. You can go outside. If you cannot, doctor, I cannot go outside. Okay, put a plant in your desk. It makes a very big difference. Stand up every hour when you're doing when you're doing work from home. Don't forget to stand up. You don't forget to take a break. If you don't have that opportunity or luxury, reward yourself. It's okay lang to play ML. Okay lang to watch a video in between, as long as you don't feel like you are deprived from doing things that you are happy with. So,
Uh,
para ma-avoid mo lang yung burnout na yon, para ma-avoid mo yung feeling, I'm so tired and overwhelmed, do not forget yourself.
and get a very and pray for a very good support group.
Yeah.
It matters, di ba? If you're in a household na ano. Anyway, so guys, it's
Oo. Hmm.
thank you very much, Doc. I think we're gonna cut it here. So, ladies and
Thank you
gentlemen,
for inviting me.
yes, of course, you are my number one fan. Actually, 1.5 kasi si Ate BJ yung isa pang 1.5.
Ah,
So, dalawa kayo
point.
yung number one fan ko. Kasi yung point
Oo.
5, of course, yung wife ko. So, ayun, actually, number 2 kayo dalawa. Anyway, thank you very much, Doc. Ate, I will see you soon, inshallah. Alright, bye.
Inshallah.
So,
Bye-bye. Thank
so,
you.
pause.